Hello friends, my name is Dr. Tarun Madan. I am working as a senior interventional cardiologist at UN Mehta Institute of Cardiology, Ahmedabad. Today I will be talking to you about aortic aneurysm. Aorta is the largest blood vessel in the body. Although your aorta is a tough, durable workhorse, sometimes its walls can get weakened and bulge, and then it can balloon, what is called as aortic aneurysm. It can happen in any part of the aorta, and once this balloon leaks, it can spill blood into your body cavity. Sometimes it bursts, sometimes it doesn't. Other force blood flow away from your organs and tissues, so it steals blood from your organs. So in the first picture you can see there is a healthy aorta, and in the second picture there is a very severe dilatation of infrarenal aorta, which is called fusiform abdominal aortic aneurysm in the infrarenal part. There are two locations of aortic aneurysms. One is thoracic aortic aneurysm, second is abdominal aortic aneurysm. Most aortic aneurysms are abdominal aorta and located in the belly, and thoracic aorta is closest to your heart and other vital structures like esophagus and trachea and pulmonary artery. Ascending aorta, descending aorta and abdominal aorta. So these are the three main categories in which we can classify the aneurysms. There are two kinds of shape. One is fusiform, in which it is balloon like this, and saccular means there is a sac formation on one side of the wall of aorta. So what are the risk factors for aortic aneurysms? Elderly people, though it can happen in young, in which there is an inflammatory aortitis. Male sex, smoking increases the chances of aortic aneurysms. High blood pressure, that means hypertension. Genetic predisposition, if there is a family history of members having aortic aneurysms, and a patient who has got a heart valve defect, which is called a bicuspid aortic valve. Higher risk of thoracic aortic aneurysm if you have certain disorders that affect your connective tissue like Marfan syndrome, Loeys-Dietz syndrome, vascular Ehlers-Danlos syndrome and Turner syndrome. Aortic aneurysm causes high blood pressure in the body, plaque buildup in your arteries, which is called atherosclerosis, high cholesterol levels, inflammation in the aorta, sudden trauma like a car crash or a fall from somewhere can cause whiplash injury and then give rise to aortic aneurysm. Untreated infection like syphilis, salmonella and tuberculosis also can cause aortic blood pressure. What are the symptoms? You can get pain in your jaw, neck, chest, back, abdomen, buttocks, groin and legs depending on the structures at which it is impinging. You can have trouble in the breathing or swallowing if the esophagus is getting compressed, shortness of breath if the pulmonary artery or bronchus is getting compressed, coughing, and you may cough up blood, which is called hemoptysis, which can be acute or chronic. And then especially in some arch aneurysm, if the recurrent laryngeal nerve which supplies the vocal cords gets compressed or irritated, you can get hoarseness of voice, wheezing, swelling in your arms, neck and head, feeling of fullness in your stomach, throbbing sensation near your navel. If the aneurysm ruptures, serious symptoms will come on quickly. You might have sudden intense pain in your chest, neck, back and abdomen. You can become pale, sweaty skin, very faint pulse on examination, fast heartbeats, tachycardia, dizziness, numbness, tingling in your arms and legs and nausea or vomiting. How do you diagnose these patients? They are found on imaging, either the chest x-ray, abdomen x-ray if there is a calcium, or the imaging ultrasound. That's the best way to pick up your aortic aneurysms, and sometimes echocardiography also can pick. After the echocardiography and the ultrasound, your physician or the cardiologist would tell you to go for CT scan or MRI, which are the two advanced modalities. Complications can happen in the form of blood clots, dissection or rupture. Clots can form inside the cavity and can get dislodged to the distal organs. If it happens to mesenteric organs, can cause mesenteric ischemia. It happens to legs, it can cause claudication or acute limb ischemia. If it happens to brain, it can cause CV stroke. Dissection means the wall of the blood gets split because the normal aorta has got three layers, which is tunica, intima, media and adventitia. If there is a tear in the intima, it's called dissection, and then you get subintimal hematoma, which tears the whole aortic wall into two parts. One is false lumen and one is true lumen. And a tear through all the three layers causes a rupture. So, less than 65 years age, men, women, multiple risk factors, consider ultrasound screening as a modality to pick up preclinical abdominal or thoracic aortic aneurysm. More than 65% of age male with a family history should undergo ultrasound screening. Who have never smoked should undergo ultrasound screening. And women with family history and who have ever smoked, they are reasonable for ultrasound screening. And more than 75% of the age, male or female, asymptomatic with negative initial USC should undergo repeat ultrasound and screening. Is not recommended in them. What are the treatment options? Aspirin, which is an anticoagulant, blood pressure medications which are ACE inhibitor, ARB, diuretic or beta blockers, statins to control the cholesterol levels, quit smoking. It's one of the very important part of your treatment. Healthy eating diet, which is less salt and less in fat, manages the stress, because the stress also increases blood pressure, especially the thoracic aortic blood pressure. And then how do you treat them? There is two kind of modalities. One is open aneurysm repair, in which the aneurysm is cut out, an artificial tube called a graft is sewn in place by a cardiac surgeon or a vascular surgeon. If the aneurysm is close to your heart, the tube has to be attached to your heart, and the valve between the tube and the tube itself is connected to the distal part of the aorta. And you will most likely have this procedure if your aneurysm is in your chest. You can expect to take a month or more to recover because you undergo sternotomy. And these are the recommendations from endovascular versus open repair, class 1 indications, Marfan syndrome and vascular syndrome, who have descending thoracic aortic aneurysm that meets the criteria for intervention and anatomy is suitable for endovascular repair. TEVAR is recommended over open surgeries, friends. So, in patients with descending thoracic aortic aneurysm, if the criteria are met for TEVAR who have smaller or diseased access vessel, consider for alternative vascular access like a subclavian or axillary access. And in patients with descending thoracic aorta that meets criteria for intervention, who have anatomy unsuitable for endovascular repair, who are without significant comorbidities and have a life expectancy of at least 10 years, open surgical repair is reasonable and the level of evidence is class 2A. And on the right side we see ruptured abdominal aortic aneurysm with low to moderate operative risk should undergo a EVAR level of evidence 1, and elective endovascular for unruptured abdominal aortic aneurysm. Adherence to manufacturer's instruction for use is very, very essential. In patients with non-ruptured AAA abdominal aortic aneurysm, a high perioperative risk, EVAR is reasonable to reduce the 30-day modality. And for non-ruptured abdominal aortic aneurysm AAA, moderate to high perioperative risk, anatomy suitable for a FDA fenestrated endovascular device, EVAR, FEVAR or fenestrated EVAR is reasonable over open repair, which reduces the risk of perioperative complications up to great extent. So, we come to a conclusion here that thoracic and abdominal aortic aneurysms are undiagnosed a lot of times, and if the patient presents with rupture, it can be catastrophic, it can be fatal. So, early screening, early diagnosis and early intervention is the key to a better outcome and a long life for the patient. Thank you so much.